You were called to a 76-year-old female with chest pain and shortness of breath. General impression. A 76-year-old female complaining of chest pain and shortness of breath. Patient appears to be in pain. She is pale, cool, and clammy.
Okay. Proper PPE. Is my scene safe?
Yep.
Alright, so general impression I have how old did you say she was?
76-year-old female.
76-year-old female. Nature notice is shortness of breath. Is she sitting in like tripod position?
No, wait. It doesn't say that, no.
Doesn't say? Yeah, it's gonna be safe to assume that she is.
Yeah.
So she's gonna be sitting, so I'm not gonna consider C-spine. Is this my only patient?
Yeah.
So then I'm also not gonna request additional units as of right now. So. Hello, ma'am. Can you tell me your name?
My name is John.
You're just verbal. Learn verbal.
Okay.
Or, like, how times 2.
Alright, can you tell me what day of the week it is?
General impression is a 24-year-old male
And then can you tell me where you are?
unable to swallow. He's in a patient is found in a tripod position. He looks very ill with flushed skin.
Your house, actually.
John, can you tell me your date of birth?
First, I'm gonna start by. He's sitting up, so his
You know where you
airway
are?
is clear.
I think so.
You know what day of the week it is?
Mm-mm.
I'm gonna start the
Alright, well, we're gonna
respiration.
give you some oxygen at 15 liters via non-rebreather. This is just gonna help you breathe a little better.
Okay.
Labored
Does
respiratory.
that feel okay? So since my patient is talking to me, and I think the airway is clear, I'm gonna check cap breathe flow really quickly.
SpO2 is 94%.
And then I'm gonna also take the sounds also.
You said 96%?
94%.
Alright, can you breathe in for me, please?
I want to get a respiratory rate. So, ma'am, is it okay if I just put my hand on your back?
Mm-hmm.
Breathe in. And out.
Respiratory rate is 20.
Okay.
And out. And breathe in. And out. I'm gonna do the same thing on your chest.
I'm gonna check radial pulse.
Breathe in.
And
Breathe in. Breathe out.
Pulse is 60.
Breathe in.
Thank you.
And one last time, breathe in. And breathe out.
Tell me what's going on with you, like your.
Okay, so patient priority is high, so I'm gonna take her to the ambulance and just ask her a few questions.
Okay.
Open the ambulance. Okay, ma'am.
And then
What are you doing in this shortness of breath?
circulation.
Or is she still just?
Patient felt like she had indigestion and wasn't able to sleep. The pain became worse and she called 911.
Okay. Is there anything that you think provoked this?
Any movement makes it worse.
This is his everything. And then also, sorry, I'm gonna start by asking you some questions.
Okay. And what would you say this feels like? Is there like a pain in your chest?
Crushing, constant pain.
Okay.
Alright. I have a heart rate of 81 and then SpO2 of 98.
SpO2 is 92.
And does that move anywhere? Like, does it radiate at all?
Between the
Heart
shoulder
rate,
blades.
63 now.
104 are
104.
Or just put my hand. Is that okay if I can put my hand on your chest?
Alright. Do you know what time we started?
Okay, at this time, I'm gonna also take
What
this.
started?
Is that okay?
When it started?
Just want to make sure he puts it on right correctly the first time. Did he put that on you correctly?
Are you allergic to anything?
Dig deeper.
Any medication you're on?
Still Tiazam or
And then do you have any past medical history?
Same rule.
3 days ago, I was hospitalized for atrial fibrillation.
Alright. What? Sorry.
3 days ago, I was hospitalized for atrial fibrillation.
Atrial fibrillation. Anything else? Have you
It doesn't
been-
say anything about
been in
lung
hospital
sounds, so
for
I assume they're
something
fine.
like that before? Atrial fibrillation. And when was the last time you ate?
I'm also just gonna give you a blanket so you're not cold in the ambulance. What is the severity
What were you
of?
doing? I'm gonna get it for.
8 out of 10.
And so how long ago would you say this started?
2 hours ago.
2 hours ago. 2 hours.
So,
Okay, so well, do you have any
anything
allergies?
that provokes it.
No.
What's the quality?
No.
Oh wait, it said lung sounds are clear and equal, feels slightly short of breath.
Okay.
Does it go anywhere else? Like, does it radiate anywhere else?
So no allergies?
Yes.
No
To the
allergies.
shoulder and
Okay. What about any medications?
ASA,
Alright, I'm gonna stop right here. I'm gonna go. You want me to
lisinopril,
put the blanket over you, treat for shock. I'm gonna ask you for a pillow. And we're gonna get to the ambulance.
Okay.
lisinopril,
We're gonna try to make it to Region Hospital, but
lab,
we're gonna
lovastatin,
go to St. John's Hospital right off of Avenue. And then
Statin.
and metoprolol. Metoprolol.
I remember that one from
Can
mentioned.
I see your I'm gonna do your blood pressure.
Do you have any past medical history?
I had 2 previous heart attacks, hypertension, and high cholesterol.
And
So hypertension or hypotension?
Hypertension and high cholesterol.
alright, while that's running, can you tell me
Cholesterol
what
and
time
a history of heart attack?
2 previous heart attacks.
2
and then after this gets done, I'm gonna start my second set of vitals.
So now I'm gonna start my secondary assessment. So was she responding to me at that time? She was responding to me.
Yeah, she's still verbal.
Okay, so she was responding to me. So the pulmonary was clear.
It's chest pain.
The cardiovascular, I do have some concerns just based on what she's feeling right now and her past
It's pulmonary because you have
history.
shortness of breath. And then
What was your last oral intake, by the way?
I am
6 hours ago.
You said no allergies medication.
He's not allergic to anything. Just to be clear, you don't have any history of disease.
History of what?
Alright.
The musculoskeletal seems okay. The neurological, she's not freaking out, so that's okay.
Acetaminophen.
Yeah, I think I'm gonna get a second set of vitals. So I'm gonna take some blood pressure.
Hopefully that will help. Second set of vitals.
Whichever arm you. This one?
Second set.
Yeah, sure.
His blood pressure is at 146 over 78. Alright. And then I'm gonna start my second set of vitals. I have
Did you close the door?
65, my 70 heart rate.
Very kindly.
If it's higher.
And then SpO2 is 98.
You first getting sick started. Like my sore throat? Yeah. My sore throat probably got bad like half an hour ago. Yeah.
And then
it just started hurting really
I'm
bad.
gonna do another one of
Couldn't swallow.
1.5 or 4 hours.
I got sick. I had like the infection with flu. And do you have anything at all? Yeah, just like right in my throat. I'm not sure that's what it was.
This also doesn't affect the GU tract. It does not affect the reproductive system.
Blood pressure is 110/80.
His
Repeat that
blood
one.
pressure will be done here.
110/80.
I don't know, so, you just can't swallow, and it's just like,
I got 137/75.
138/70.
And we'll start on more pro. Respiration, you put my hand on your chest and back.
Just very quickly, I'm gonna have check pro. So man, if you could just look at my finger and follow without moving your head.
how bad is it? Like,
He has
how long
pro.
was it for them? Probably 8, 9?
Alright. I got 12 that time.
And I'm gonna check just skin temperature. So I'm gonna put the back of my hand on your forehead. Is that okay?
20 unlabored.
Pale, cool, and clammy.
Now I'm gonna go back and do another sample. I'm just gonna go
Alright, so just on the way to the hospital, I reassess every
So far I have
34 minutes until we get to the hospital.
And
Okay, so now I guess I'll give my report.
Oh yeah, here.
Yeah, so I have a patient here, 76-year-old female, John, complaining with shortness of breath. Says she felt like she had indigestion and like some chest pain. She says movement makes it worse. She says it's like between her shoulder blades. Her lung sounds are good and equal. She said their severity is like an 8 out of 10. It started about 2 hours ago, and the last time she ate was about 6 hours ago. She has no allergies. Her medications are ASA, lisinopril, lovastatin, and metoprolol. Past medical history, she has a past medical history of hypertension, high cholesterol, and 2 previous heart attacks. The last time I checked her blood pressure, it was 110/80. She has pearl, but her skin is pale, cool, and clammy.